Imagine a healthy and productive workforce with programs in place to prevent and manage the illnesses that tend to keep us away from work. Consider the possibility of having readily available resources to help easily navigate through this incredibly complex healthcare landscape. Well, we have reached out to patients, healthcare systems, and employers to identify the healthcare needs of our community and the state. As a result, I'm pleased to share with you that Griffin Health, Middlesex Health, Newvance Health, Trinity, and Prospect Health, in collaboration with Aetna and our Value Care Alliance partners, has designed a way to take this from imagination and wishful thinking to a reality every employee can experience.
When faced with a seemingly insurmountable challenge, it makes sense to join forces. This is why the Value Care Alliance, a collaboration of hospital systems, is sharing insight, processes, and resources to deliver consistent, high-quality, and affordable care to the residents of Connecticut. This innovative partnership is made up of Danbury Hospital, Norwalk Hospital, New Milford Hospital, Griffin Health, Middlesex Health, and Trinity Health of New England, along with thousands of affiliated physicians. We all share a common vision focused on managing the cost of healthcare while improving patient outcomes and their care experience. With the addition of similarly capable and like-minded pro-health physicians and Manchester Memorial Hospital, we are now able to cover the state with a network of high-value healthcare providers to serve as the foundation of the innovative Aetna Whole Health product that is the market's best example of value-based insurance design. Partnership with Aetna is a best practice initiative we're implementing to give our patients and their employers the highest quality healthcare at a location close to home at an affordable price.
Every year, I would have to build higher and higher healthcare costs into our budget, most times over 5% and sometimes a 10% year-over-year increase. But the worst part is that we had to tell our employees that their costs were going up again and again. The bank could only take on some of the increased costs. Our employees were running out of options. We had to do something to break that cycle. We dug into the details of the root causes of the excess costs. We noticed two things. One is that we were not doing enough preventative care, as several of the largest costs were emergencies that didn't have to be emergencies. And second, the cost of simple, basic, and common procedures can be 2 or 3 times more at one care provider compared to another. That's when Aetna came in. Aetna created the Whole Health Plan. It's an ACO-only plan which provides employees with a low deductible for using high-quality, maximum-saving providers. The proactive biometric screening and participation of high-quality primary care physician instantly broke that cycle. Almost 10% of the individuals in the plan discovered for the first time that they needed to address a health problem before it became an emergency.
In a world of competing healthcare systems and diverse insurance options, tiers, and plan design types, consumers face the challenge of figuring out who to see, and where to go, and what their coverage is, to avoid breaking the bank when managing the health and well-being of their family.
We better understand the best options for employees to help reduce costs without compromising quality care. Not only did we break the negative cycle, we've turned it around and each year are seeing better and better results, ultimately reducing our costs for the bank and our employees. And the best part, we know employees and their families are healthier and happier.
One of the biggest differences for this plan is that as part of the network, these physicians, hospitals, emergency rooms, and urgent cares are already familiar with each other. Even though they're not owned by the same company, there is just this real commitment to being coordinated on your behalf.
Employers can now make a long-term investment in one of their most valuable assets, their people. We're talking about consistent, reliable, and transformational healthcare, where employees are offered tailored programs to help them prevent or manage chronic illnesses, build a trusting relationship with a primary care provider, find affordable medications, and stay out of the hospital.
The members will be exposed to a one-stop shop resolution, which means that if they need help in managing access to healthcare or have a disease or complications of health, they'll have a medical professional to help guide them and keep them on their care plan. One-stop shop resolution aids the member in getting and staying healthy which in turn helps everyone achieve success.
With the Aetna Whole Health Plan, employers are able to offer a value-based healthcare option to their employees instead of the traditional and difficult to navigate pay-for-service approach. Our value-based insurance design uses financial incentives to encourage people to get the right care at the right time from the right provider. Members are asked to choose a primary care provider to serve as their long-term healthcare quarterback.
Primary care physicians are the ones who are going to be directing your care and making sure that you receive the right care at the right place and at the right time. The American healthcare system, very simply, it's complicated, it's confusing, and it's expensive. By using the Aetna Whole Health product, your primary care physician will be able to make sure they're coordinating and streamlining your care. And they will know exactly where you are in your journey, so you receive the care that you need.
This relationship enhances communication and continuity of care for your employees and ultimately engages them with a healthcare partner who will navigate their health maintenance needs and improve their overall patient experience while driving efficiency and controlling costs for you. This well-rounded approach to managing costs for the employer and employee is made possible by Aetna and a broad network of high-value providers spanning the entire state of Connecticut. Our goal is to partner with employers to cultivate wellness in the workplace and engage employees to become active participants in efforts to improve their health and well-being. There are real benefits of this enhanced program. Easier to access comprehensive employee health risk assessment to guide effective care plan development, care teams that include a physician and nurse practitioner or physician assistant to improve patient access so getting in to see a primary care provider is faster. Members will receive a gold ID card from Aetna, which will identify their primary care provider, as well as critical plan and network contact information. The gold ID card will also easily identify Aetna Whole Health Plan members when checking into a provider's office. Claims data from your health plan can be analyzed to determine which conditions are most prevalent within your workforce, allowing you to engage in wellness incentives and tailored chronic disease management programs. And we have systems in place to make sure patient information is shared among caregivers, eliminating redundant medical tests and procedures, enhancing communication, and facilitating continuity of care.
By avoiding duplications in services, and then also by making sure that the patients are getting the services that they need, such as diabetic eye exams. If we can get a diabetic eye exam and treat damage to the back of the eye much earlier in the disease, we can save that patient's vision, and we can also prevent lots of costly treatment down the road.
With a focus on preventive care, chronic disease management, managing prescription drugs, and physicians with proven positive results, employers and employees realize unparalleled benefits with the Aetna Whole Health approach. Better employee health, resulting in improved productivity and reduced sick time, with a primary care provider leading the care for every health plan member. Unnecessary or redundant testing and procedures will be reduced. An increase in employee satisfaction resulting from a healthcare plan that offers enhanced resources and less out-of-pocket expense.
Instead of competing against each other and driving up healthcare costs in the process, our Alliance member health systems have established a spirit of collaboration and a willingness to share best practices to serve employers as well as their employees and their families. Joining forces has allowed us to be creative and take a smarter and more innovative approach to healthcare delivery, and in the process, make healthcare more affordable in the state of Connecticut. I challenge you to imagine what enlightened high-value hospitals and physicians, working closely with an innovative health insurer, can achieve by entering a partnership with you and your employees to control healthcare costs and improve the health and well-being of your workforce. Consider Aetna Whole Health as the vehicle that I believe can make that vision a reality and a true improvement in employee health and well-being. I encourage you to consider Aetna Whole Health I believe it is the vehicle that is capable of making these improvements in employee health and well-being possible.